Mhm. Hello and welcome. Happy Tuesday. Welcome to this week's Week in Review. I'm Molly, sitting in again for Karen Anderson while she frolics and plays at the beach, I'm sure. Um, but I'm happy to be here, and we're going to go over a week's worth of all of our posts that we've posted to our website, aortichope.org. And we're coming to you live on AHTV, which is Aortic Hope's YouTube channel. So while you're here, and since you're not doing anything else but listening, go ahead and click that like button, share away to all your friends and family, and hit that little bell. And that will give you notifications for any time that Aortic Hope goes live on AHTV, because there's so many great programs that we host here for you. If you haven't checked it out, check it out. Come on to the website and go under programs and events, and you'll see what we have to offer. So, all right. Well, Joshua, should I just get started? All right, I
All right,
am.
you're
All right.
doing
So we're
great.
going to
Let's say hi to Christina.
thank you so much for being here, Christina. I kind of put this together real fast, so I'm happy you're here. Keep me entertained. Go ahead and get crazy on the chat and make me happy and laugh. Oh gosh. Okay. Well, thanks for being here, Christina. I hope you're staying cool up there in East Texas. Um, let's go right into Medical Monday. And this one is provided by one of our medical students, Samantha Cologne, and it's regarding median sternotomies, which some people here may be very familiar with. All right, so she says, welcome back to Medical Monday and happy last day of June. So this is last week. We have a new one for this Monday. Aortic Hope family, she's saying, welcoming everyone. Ever wonder how surgeons access the heart for major procedures like valve repair or aortic surgery? One common way is through something called a median sternotomy. And let's break it down in simple terms so you know what it is, when it's used, and what kind of scar to expect. So what exactly is it? It is a surgical incision made down the middle of the chest through the sternum or the breastbone. And this approach gives the surgeon full access to the heart, aorta, and nearby blood vessels, which is crucial for life-saving procedures. It's most commonly used for open heart surgery, valve repair or replacement, aortic aneurysm or dissection repair, or coronary artery bypass grafting, cabbage. So here we got a really great, some images here, different types that they have. The median sternotomy is in the middle. There's a thoracosternotomy on the right side, and then the line of thoracotomies right there on the side. Okay, so how big is the incision? It usually runs from just below the collarbone down to just above the top of the abdomen, about 6 to 8 inches long. The sternum is carefully split in half and later closed with surgical wires, which stay in the body permanently. The scar fades over time, thankfully, but everyone heals differently. Some people have a thin, barely noticeable line, and others may have a more visible scar, depending on your skin type and how you heal. And the recovery is like most people spend about 5 to 7 days in the hospital when they have one of these procedures. Um, a full recovery can take 6 to 8 months, 8 weeks, or more. And patients are advised to avoid heavy lifting and upper body strain while the bone heals. Many people attend cardiac rehab to regain strength and confidence, which is a great thing to do. Go to cardiac rehab because they're looking after you and checking out, make sure that you're doing okay there as you get back up on your feet. Um, will you be okay after? Yes, you will. While the scar may be intimidating, a median sternotomy is a well-practiced, safe procedure when done by experienced surgeons. It allows for precise, life-saving operations on the heart and great vessels. Many patients feel stronger and more energetic once they've healed, especially if surgery was done to fix a problem like a valve dysfunction or a blocked artery. Her summary is a median sternotomy is a common chest incision used in heart aortic surgeries that involves splitting the breastbone to access vital structures. It's usually about 6 to 8 inches long. And while recovery does take several weeks, it allows for life-saving procedures with excellent outcomes. If you or someone you love is facing this type of surgery, knowing what to expect can make it a lot less scary. Thank you for joining Sam this week for Medical Monday. Have a great start to the week. Always thinking aorta. Yes. And we also have Aortic Hope has a aortic disease, the patient guide, and aortic dissection, the patient guide. And there's a lot of information in there regarding sternotomies and the surgeries. If you haven't gotten one of your copies, they're free and they're easy to download. All right, let's roll right into Topic Tuesday. It's on the heels of the median sternotomy. This is by Purab, who is also a medical student for us and contributes some of this really great information we like to share. Hello, everyone. Welcome back to another Topic Tuesday. Yesterday, we talked about the median sternotomy, the most common surgical approach used for open heart surgery. Today, we'll be talking about another approach that surgeons use, known as the posterolateral. Help me out with this one, Joshua. I want to get it right.
Thoracotomy?
Thoracotomy. God, that's embarrassing. Will you check that out for me so I don't have to butcher
We're
it?
fine.
All righty. Well, there it is. Great picture of the thoracotomy. Thoracotomy. All right. Post-lateral. All right. So this is a type of chest incision that allows surgeons to access the structures inside the chest cavity, especially the lungs, esophagus, and most importantly, for our purposes, the aorta. The name comes from the location and direction of the cut. Postero refers to the back and lateral means side. In this approach, the incision usually begins near the shoulder blade and extends downward and slightly forward, following the curve of the ribs, just like this little picture is right underneath the arm. To reach the aorta, surgeons carefully separate muscles and spread the ribs to create space. The specific rib space that is entered depends on the surgeon and part of the aorta that will be operated on. In some cases, a portion of a rib may be removed to allow better access. Ouch. The portions of the aorta that are best visualized with this incision are the descending thoracic aorta along with the abdominal aorta. For this reason, patients requiring open surgical repair of the descending thoracic aorta, or both the descending thoracic and abdominal aorta, known as the thoraabdominal aorta, thoracic, okay, will often receive a postlateral thoracotomy. This most often includes patients with aortic aneurysms who are better suited to open surgery than endovascular, which is stent-based treatment, or those who have failed such treatment. Patients with chronic type B aortic dissections may also receive open surgery through this incision in certain circumstances, though blood pressure control and endovascular treatments are usually preferred in the management of acute type B dissection. So here we have some great imaging of different aneurysms, lots of different ones. So postoperatively, because this surgery involves opening the chest and spreading or removing ribs, recovery can take time, and patients can expect a hospital stay of several days to weeks, depending on the complexity of the surgery and baseline health of the patient. Many patients experience pain postoperatively from injury to the nerves that run near the incision. Nerve blocks, epidurals, or medications are also often used to help manage this. So this is a major operation, but in experienced hands, it provides safe and effective access to critical parts of the aorta. And we hope you learned something new from this week's Topic Tuesday. That was a mouthful, and that teaches me to read this over once before I come on here.
And
Yeah.
while we're welcoming
So,
people, Tom has entered the chat.
hi, Tom. Hello there. You'd be real proud of my garden, Tom. I'll have to take some pictures for you. I have lots of things growing in there. Tom helped me with my my vegetable garden. Well, good. I'm glad you popped in, Tom. We're going to welcome Mike Niederreither. And look at that great picture. He is a volunteer for Aortic Administrative Services. And this is a way that we started off July with a special welcome for him for his volunteer in administrative services. Mike is joining our team to help keep physicians and the community informed with the latest updates and resources, plus tackling other key projects. Mike was raised in rural central Pennsylvania and lives there today with his family. After high school, he attended college where he focused in the environmental field, receiving degrees in geology and hydrogeology, and has since had a long, successful career as an environmental consultant, managing the remediation of contaminated soil and groundwater at sites across North America. His involvement with the Aortic Hope Foundation came as a result of a type A and B aortic dissection that he suffered during a work meeting in upstate New York in August of 2023, so just 2 years ago. Thanks to the prompt attention from local medical services, he was quickly transported to Rochester General and rushed into surgery to successfully repair the type A dissection and to reattach his aortic valve. The information and support provided by the foundation was instrumental in helping Mike and his family make their way through this life-changing event and ultimately led to his strong desire to give back by supporting the Aortic Hope team and its mission to spread hope, create awareness, and provide support. Mike has been married to his wife, Kim, for almost 39 years, and they have 2 children, Marissa and Brett, and a son-in-law also named Mike, and 2 grandchildren, oh, cute, Braxton and Oakley, cute names. He recently retired from his environmental consulting career and is looking forward to spending more time with the family and moving into the next chapter of his life. Well, welcome, Mike. We are so happy you're here with all your experience, and sorry that the way you came here, but we love the fact that you're interested in giving back. And I think that's how I got started here too, giving back to this organization that helped me so much in the beginning years and months. So yeah, welcome, Mike.
Welcome, Mike.
I believe he did a survivor story. He did. And go check that out. That's also in the AHTV, the live events and Survivor series. Speaking of, so we did a Survivor Series replay Saturday with Dr. Eduardo Siles, and we like to highlight some of these older recordings, just in case you missed it, or they're really moving stories, and I think people can take something away from them. And so yeah, we wanted to highlight his story. And he's an orthopedic surgeon from Barcelona, España. And he shares his story of survival from his type A aortic dissection, and despite being in such top physical shape that he was in, and he had no medical issues. He describes his journey through several surgeries and various medical complications. So go check that story out. It's pretty good. It's pretty good. And if you do want to share your story, go ahead and submit it to, well, Joshua and I will take it, and we'll set you up with a live event. You can record it. He can help you record it. You can record it on your own, or if you're super, super shy, you can do a written story, and we will read that over the website. And participate in the Survivor series. It's really helpful. It's really helpful. This community loves it. So yeah, let's do it. Let's do it. Yeah. So have you seen that story? Have you read this story yet or seen this story yet, Joshua?
I produced that show.
Yeah, I thought so. Yeah, it was a good one. I liked it a lot. Right. Well, let's see what we have here. Global Heart Hub Health, Global Heart Hub Heart Valve Disease Patient Council in Milan, Italy. So Aortic is affiliated with Global Heart Hub, and they are having a, well, let's just talk about it. Jenny Schaefer, who also volunteers for Aortic and is on the board of directors, is she's Director of Partnership and Development, Jenny Schaefer, and she'll be representing Aortic at the Global Heart Hub's Heart Valve Disease Patient Council meeting and industry roundtable in Milan, Italy. I believe this is her second time she's gone to Milan. And yeah, she's very active with Global Heart Hub. This esteemed event focuses on heart health empowerment through advocacy, partnerships, and trust, aligning perfectly with our mission, empowering patient advocacy. That's what Heart Hub, Global Heart Hub is really all about, is patient advocacy. Jenny will also participate in the masterclass, Patient Advocacy Training, equipping her with valuable insights and expertise to foster global relationships and advance Aortic Hope's advocacy efforts. A global voice for heart health. And as the first global nonprofit umbrella organization for patient organizations and patient advocates, Global Heart Hub provides a powerful voice for those affected by cardiovascular disease. And we're excited about the potential global collaborations and opportunities that will arise from this event. And we look forward to hearing about Jenny's experiences and insights upon her return, which I can't wait to hear about that too. In fact, we should get her on here and have her talk about it. I think a lot of people would be really interested to see, what that all involved. And, you too can get involved with Global Heart Hub. If you're interested, just write to us at info@aortichope.org. Here's John Ritter. So John Ritter, the foundation, it has a research program for genetic testing. And if you have a loved one or you have been diagnosed with thoracic aortic aneurysms or dissection, John Ritter Research Program would love for you to take part in this research study. Doctors and scientists have identified about 20% of the genes that cause aortic aneurysms and acute aortic dissections to be inherited in families. So, furthermore, studies are just beginning to look at the role of genetics in patients who have had aortic dissection but do not have family history. These research studies aim to learn more about the genes that cause people to have aortic aneurysms and acute aortic dissections. Further identification of the genes that cause people to have these conditions will increase our ability to identify who is at risk and provide information on how better to diagnose, manage aortic and vascular diseases. To learn more about these ongoing studies, contact the genetic counselor at that email. And more information can also be found on the Aortic Hope website. Wrapping it up. So this is the first, that's actually the start of the second week in July. I can't believe our summer is just breezing through. So tonight there's a West Coast, well, we call it West Coast because it's at a more favorable time for those on the West Coast at 7 p.m. Pacific time. So 10 p.m. tonight is a support group meeting. I believe Melissa will be moderating this one as Mark Matucci is off and running about Europe. Wednesday, we have the Caregiver Connection for caregivers, and that's at 10 p.m. Eastern. And this Thursday, we have Therapeutic Thursday with John Quick. That's a really good one if you haven't checked that out. We have the Bereavement Support Group on the 10th at 7 p.m. Eastern. And Sunday, we have Qigong with Kevin Songer. And that's at 12:30 Eastern. And if you haven't checked that one out too, that's really easy. And it's just a great way to start your Sunday morning. So check out Qigong with Kevin Songer. Well, that wraps it up. I think that's it. That's what we have for you this week.
Excellent work.
Yeah. Any is
No,
Christina
chat's pretty
entertaining me
quiet.
in chat? Oh, okay. That's fine.
She's
You
working.
know,
She's always working.
well, I'm glad she popped in here, and Tom also. So thank you very much, keeping me company. Yeah, that's it. And I think next week you're going to have Tammy's going to sit in here for me and Karen. So look for her next Monday, and thank Aorta, and like and share and get a little notification bell check. And then you can come and join us for all of our events. Ask a doctor, ask the pharmacist. I mean, so many great things. And download that patient guide. It's really important. All right, until next week, we'll see you later. Have a good one. Bye.